Hi, I'm Professor Stanley Malamed, and I'm here today to discuss the Gow Geigs mandibular block technique. Effective pain control is an essential part of a successful dental practice. Normally, achieving pain control is easy. When problems do occur, they most often happen in the mandible, specifically with mandibular molars. The traditional inferior alveolar nerve block has the lowest success rate, approximately 85%, of all nerve blocks administered in the human body. Most of the time, the problem occurs in mandibular molars. The reason has to do with the thick cortical plate of bone in the adult mandible, which precludes the administration of infiltration anesthesia. The most common reason for missing the inferior alveolar nerve block is injecting too low. As most doctors realize, injecting a little bit higher is a little bit better. The Gow Geigs mandibular block is a high mandibular block. We're depositing local anesthetic at the neck of the mandibular condyle. The tragus is the equivalent of the head of the mandibular condyle. Just below the tragus is the intertragic notch. This is the equivalent of the neck of the mandibular condyle. As described by Dr. Gow Geigs, the intertragic notch, the target for deposition of local anesthetic, is located by placing a finger in the intertragic notch. The barrel of the syringe is placed in a corner of the mouth on the opposite side and is aimed for the finger in the intertragic notch. A 25 gauge long needle is used in the Gow Geigs mandibular nerve block. The barrel of the syringe is placed in the corner of the mouth on the opposite side. The needle is placed just below the mesial palatal cusp of the maxillary second molar, and then the tip is moved just distal, about 2 or 3 millimeters distal to the maxillary second molar. This is the insertion point. The needle is then inserted until bone is contacted, usually at a depth of approximately 25 millimeters. Following 2 negative aspirations, a volume of 2.2 mL of local anesthetic is deposited slowly. At the completion of the injection, the patient is asked to keep their mouth open for 2 minutes and is positioned comfortably. Once the doctor learns the Gow Geigs technique, its success rate exceeds 95%, much higher than the inferior alveolar nerve block.